Hospital in Norwich have to improve, according to the government's main health watchdog. The hospital treats people with mental health problems in Norfolk and Suffolk, but the Care Quality Commission highlighted failings in the care and welfare of patients and failure to treat them with respect.
Inside this hospital are some of the most vulnerable. Yet when inspectors came, they found patients had been left with incomplete care plans, unrisked, even left in dirty clothes.
That was a one-off case which is absolutely unacceptable. I've been talking to the nursing staff about making sure that we provide the absolutely fundamentals of care when people come into hospital. It's a time when people feel vulnerable and they want to be looked after, and making sure that people can feel clean and cared for is absolutely what we have to be doing.
The union Unison says it proves that cuts to the service are having an impact.
We have been trying to work constructively with the Trust all the way through. To a certain extent, their hands were tied by the budget that they've been set. But we think on certain things they've taken their eye off the ball and focused too much on trying to meet financial targets and not listen to us and staff that work in the service when we say actually this is having an impact on patient care and patient safety.
£40 million worth of savings are being made in 4 years. That'll mean 400 job losses and a 20% reduction in beds.
One of the issues raised by inspectors is a backlog in mental health assessments by community nurses. Some people have been waiting as long as 2 months just to find out how ill they are and whether they actually need to be treated in hospital.
But the Trust says it is taking action.
We know that within our redesigned services are prioritising those people with urgent care needs, and we are seeing those within agreed timeframes. We have been recruiting extra nurses and running additional clinics, particularly at weekends, to catch up on the backlog, and actively monitoring to make sure that we are seeing people within the timeframes that we think we should be working to.